8:23 here, Big 550 KTRS. Dr. Bradley Freeman checks in with us, professor of surgery at Washington University Med School. Good morning, Dr. Bradley Freeman.
Good morning, McGraw. Good morning, Kelly.
Good morning, Doc.
We love to talk about 3D printers, and you found a story where a doctor implanted a 3D, I want to say a 3D body part into a human being. Tell us about it.
Yes. Hey, can I just interject? I want to just follow up on a story you covered last hour that I thought was very important.
Yes.
And that was about the problem with narcotic abuse in Missouri and the need for a way to monitor that. And your commentator was exactly right that Missouri is the only state in the union that does not have a prescription drug monitoring program. And interestingly, that bill comes up in the legislature every year. It's broadly supported by all the professional medical associations. And it doesn't really have any natural opposition. And I think inevitably this will come up again in this legislative session. And we should revisit this in a few months. And I think you, with your bully pulpit, could really mobilize the base to get something passed. And I think it would really profoundly affect the problem that you really outlined last hour. So, I think something that we should really work on as a community.
Doctor, say the word, and we can certainly talk off the air as we get closer. But it's interesting you say there's no natural opposition, and yet that bill continues to fail every year.
It fails every year. It's been introduced for at least the last 3 years, and it would be relatively inexpensive to introduce, and I think would really have a profound effect on these narcotic drug deaths. But going back to the story, so 3D printers is very sexy. We're seeing all kind of applications. We've talked previously about how they might be used in medicine. So this was a story out of Spain. This patient had a cancer that required resection of a large part of his chest. And so one of the things that has confounded surgeons in the past is how do you reconstruct that? Well, this group, in a very novel fashion, on a 3D printer used titanium, which is very commonly used in reconstructing body parts, to really reconstruct an anatomic model of what they resected. So if you think of a chicken, if you say cut up chicken and you know how complex that chest wall is, they basically used a 3D printer to reconstruct the chest wall out of titanium and then used it to reconstruct them. So I think this is a very novel application, and I think it really shows the potential of this technology, and I think we're going to see a lot more of this.
Well, they say with 3D printing, it's great because it can personalize something, and so your rib cage might look a little different than my rib cage, and so they can print up something that fits your rib cage, and then they can print up something that fits up my rib cage, and so that personalized creation is what's fueling this sort of 3D printer craze.
Absolutely, and so you could think, so they used it here for something that's relatively complex structurally. If you think about, say, your ribs and your breastplate, which the technical term is the sternum, so somewhat of a complex structure, but you're absolutely right. You could essentially understand by doing fairly sophisticated x-rays to understand exactly what that would look like in a given individual and basically print it using this technology if you needed to replace it. And you would think that would have all kind of applications in terms of joints and these types of body parts and on and on. So I think this is very exciting and novel technology, and I applaud this group as to how they've applied it.
It's not just science, but it's science fiction.
It's science fiction.
And let's move on. Federal researchers are talking about our blood pressure is too high and we need to start lowering it.
So this was a study that came out last week, and it's gotten a lot of coverage in the lay press. And specifically, and the way we think about blood pressure is that there's a top number, which is the systolic blood pressure, and the bottom number, which is diastolic blood pressure. And by and large, there's been guidelines as to how you use blood pressure medicines so that patients don't have high blood pressure. And the reason that you treat high blood pressure is that it can lead to heart attack and strokes and death. So they looked at older patients, and they looked at patients specifically that had a risk of heart attack, and they found that the more aggressive they were in lowering the blood pressure, the more positive effect, meaning if they lowered the blood pressure below the number of 120, which is typically what we hadn't been doing in the past, they cut the risk of heart attack, stroke, and death by 1/3. So a pretty profound effect. And this is not going to be for everybody, but I think it's going to cause a lot of clinicians to revisit how we think about treating high blood pressure.
Doctor, interesting stuff, and we will definitely be in contact on that prescription drug bill as it works its way through the legislature, and I'll give you a call off the air, and we can sort of talk about it.
Hey, have a great day.
Thank you, Doctor. Dr. Bradley Freeman, professor of surgery at Washington University, and clearly a fan of the show. Mm-hmm. Yeah, that Jason Grellner interview that he was referencing was quite powerful. If you missed it last hour, you can certainly go to ktrs.com and go to our Facebook page and Twitter accounts, and we will post that interview for you to hear it. But it was pretty eye-opening in terms of the prescription drug that doctors prescribe is funneling and funding the heroin epidemic and vice versa, and how the Mexican cartels are working quietly in conjunction with Missouri doctors to take advantage of the prescription pain pill addiction to get people. If you can't get the pain pills, you can certainly get heroin. And so that's fueling it. It was a pretty powerful interview, and that's what Dr. Bradley Freeman was talking about. Our interview with Jason Grellner last hour. 8:29 here, Big 550 KTRS. We had a guest on